When it comes to degenerative disc disease, there are some factors that you can't control and some factors that you can. The key is focusing on the things that you can control. Here we go. Let's start with genetics. Obviously, you did not choose your spine. Some people have spines that have thicker discs and discs that hold up better over time than others. Some people have spines that wear down more quickly. There's nothing you can do about it. It's okay to acknowledge it, but then you need to focus on what you can do to slow down that degenerative process. So, genetics play a factor, but there's nothing you can do. So, best to focus on the other things. Another factor that you cannot control is trauma. Maybe you had a car accident, maybe you had a fall, maybe you had a failed surgery that didn't go the way it was supposed to. Things happen. And when these things happen, obviously there's nothing you can do to go back and change it. So again, it's okay to acknowledge it, but the key is what you do going forward. So trauma plays a role sometimes in degenerative disc disease, but best not to dwell on it because there are things that you can control. Here's a big one and one that you can control, and that is your movement habits. So, have you ever wondered why or how someone can bend over to pick up something like a pencil, or they sneeze and it causes their back to go out? It wasn't that specific movement that caused the back problem. Typically, there's years and years of poor movement patterns that are weakening the disc. So you may be doing something a certain way for years and years, and it's weakening the disc, and you don't even realize it. And then it's just a matter of time before that one final movement is the final straw, whatever it may be. And then you end up having a tear in that disc, or the tear ends up reaching some of the nerve fibers that tell your brain that there's pain. So how you move throughout your life makes a huge difference in how you bend, how you lift, whether or not you twist. These are things that once you learn how to do them properly, I believe you can slow down that degenerative process, and you can also help avoid those flare ups. Next is lifestyle factors, which you absolutely can control. Number one would be smoking. Smoking affects blood flow to your disc, which reduces the nutrition that goes to your disc and contributes to faster degeneration of your disc. Another one is a poor diet. A poor diet can increase inflammation, which increases your sensitivity to pain. A sedentary lifestyle, sitting too much, not being active. Sitting puts stress on the discs, and also excessive sitting weakens your core muscles that support your spine. Again, that'll contribute to faster degeneration of your discs. Poor sleep, believe it or not, increases your sensitivity to pain. And then finally, extra body weight. If you're carrying too much body weight, it does put more stress on the discs, which can lead to faster breakdown. So these are some modifiable factors that you really can control. And if you work on several of them, it can make a big difference. Another factor that you can control is your response to flare ups. So, anybody that has degenerative disc disease knows that unfortunately, flare ups are a part of life. They do happen. Sometimes you can control them, sometimes you can't. What matters is how you respond to those flare ups, okay? There's doing too little after a flare up, and then there's doing too much after a flare up. So, if you have a flare up and you spend 4 or 5 days, I mean, if you really spend 3 days in bed, that's too much. You don't want to spend 3 days in bed. That's not going to help you. Maybe a day, maybe two. 3 days or more is too much in the bed. That really does set you back. It contributes to weakness and further degeneration of your discs. And then on the opposite end of the spectrum, there's the folks that try to push through the pain. So they have a flare up, they've obviously hurt themselves, and they keep pushing through it and they keep making it worse. Neither one of those is ideal. The key with a flare up is recognizing what you did to flare it up, learning from it so that you can modify your activity the next time. You don't want to panic. You want to take your time and work through it, and just recognize that you're going to have some setbacks. And the setback doesn't mean failure. It means you have degenerative disc disease, and this is a part of your reality. But you want to find ways to minimize how frequently those flare-ups happen. And a final factor that you can control is your mindset. Believe it or not, fear and anxiety increases your pain sensitivity. It puts your nervous system on high alert and it makes you more susceptible to pain. Again, self-limiting beliefs, the same thing, just a negative attitude towards what you're dealing with. Just kind of conditions you to be in more pain. Being calm and confident can improve your quality of life. It can improve your ability to work through these things slowly and carefully. Also, having a support system, people that you can talk to, people that understand that you're dealing with something that's challenging and they're willing to listen to you and encourage you. So don't underestimate the importance of your mindset. It can make a huge, huge difference. If you're looking to take back control of your degenerative spinal condition, I have a free resource that you can get. It's a free video mini course, and it gives you 4 foundational techniques that I teach folks for degenerative disc disease, spinal stenosis, and chronic back pain. It's a good starting point. Again, it's 4 basic techniques. You can look at the show notes. I'll have a link to it in the show notes, and hope you take a look and feel free to contact me if you have any questions. I hope this video was helpful. Appreciate you watching.